Hi, good day. So for this video, we are going to tackle or discuss about the chapter 6, which is the types, characteristics, and identification of learners with difficulty seeing, hearing, and communicating. So sit back, relax, and enjoy our prepared video presentation. Introduction. So, what are the outlines or the topics that we are going to discuss in this chapter? This chapter discusses the various types of learners with difficulty seeing, hearing, and communicating. Among the topics covered in this chapter are learners with visual impairment, learners with hearing impairment, learners with communication disorders such as speech, sound disorder, language disorder, fluency disorder, among others, and learners with autism spectrum disorder. The different types of learners from each category are discussed as well as their common characteristics, way of identifying them are also presented. So we hope that you could enjoy and learn something from us as we discuss what is in this chapter. So take some notes if it is possible for you. So sit back, relax, and again enjoy our prepared video presentation.
So, good day everyone. My name is Jaisa May and Ambuestro, and now we will tackle about learners with difficulty seeing. There are a number of terms that are often used in association with having difficulty seeing. Here are the legal dimensions of some of these terms. Visual acuity. Visual acuity refers to the ability to distinguish forms or discriminate among details. It is usually measured by reading letters, numbers, or other symbols from the Snellen eye chart. When one is said to have a vision of 20/20, this means that at a distance of 20 feet, one can see what a normally seeing eye sees at that distance. So visual acuity or VA is a measure of the ability of the eye to distinguish shapes and the details of objects at a given distance. It is important to assess VA or visual acuity in a consistent way in order to detect any changes in vision. One eye is tested at a time. So, what is the normal visual acuity? 20/20 vision is normal vision acuity, the clarity of sharpness of vision, measured at a distance of 20 feet. So, if you have 20/20 vision, you can see clearly at 20 feet what should normally be seen at a distance. There are types of visual acuity. In the visual system, acuity refers to the ability to discriminate fine details of the visual scene. Three forms are recognized, and they are primarily a function of the cone system. First is the spatial acuity. It is the ability to resolve 2 points in space. The second one is the temporal acuity. It is the ability to distinguish visual events in time. There is a critical fusion frequency or CFF where a flashing light appears to be continuous rather than repetitive. And the last form is the spectral acuity. It is the ability to distinguish differences in the wavelength of the stimuli. Legal blindness refers to having a visual acuity of 20/200 or less in the better eye with the use of corrective lens. When one's field of vision is restricted to an area no greater than 20 degrees, one can also be considered legally blind. If you're legally blind, your vision is 20/200 or less in your better eye, or your field of vision is less than 20 degrees. That means If an object is 200 feet away, you have to stand 20 feet from it in order to see it clearly. But a person with normal vision can stand 200 feet away and see that object perfectly. So, what is legally blind prescription? Eye, eye prescriptions are given depending on the severity of correction needed to restore normal vision. Normal vision is 20/20. The US SSA uses the term legally blind in people whose vision is 20/200 with glasses or contacts or whose visual field is 20 degrees or less than the normal eye. So, is legal blindness curable? So, treatments vary depending on the cause of the blindness or visual impairment. However, in some cases, such as with retinal degeneration disorder, there is currently no cure. So, why is it called legal blindness? When someone is legally blind due to visual acuity, it means that the sharpness of their vision can't be improved beyond 20/200. Even with the help of their prescription eyeglasses or contact lenses, legal blindness is different from total blindness, which describes the complete loss of all visual light perception. Partially sighted. Partially sighted individuals are those whose visual acuity in the better eye after correction falls between 20/70 and 20/200. Partially sighted means a person has partial vision either in one or both eyes. If visual aids such as glasses can correct a person's vision to 20/20, they are not considered legally blind. And if you're partially blind, you might experience the following symptoms: cloudy vision, an inability to see shapes, and seeing only shadows. Tunnel vision. Tunnel vision is a condition of having a perception of viewing the world through a narrow tube. In this case, central vision may be good, but the peripheral vision is poor at the outer ranges of the visual field. Tunnel vision is the loss of peripheral vision with retention of central vision, resulting in a constricted circular tunnel-like field of vision. PVL or tunnel vision refers to the loss of a person's peripheral vision. It can occur for a variety of reasons, including migraine, glaucoma, diabetic retinopathy, stroke, and RP. Some causes are serious and required attention as soon as possible to help prevent further damage. Tunnel vision occurs when your peripheral or side vision deteriorates or is lost altogether. The result is that you may only be able to see things in a small circle directly in front of your eyes, as if you were looking down a tunnel. The following are educational definition of terms related to having difficulty seeing. When one has visual impairment, from the educational perspective, that means having impairment in vision that, even with correction, adversely affects a learner's educational performance. This includes both partial sight and blindness. Examples of visual impairments are loss of central vision, loss of peripheral or side vision, blurred vision, generalized haze, extreme light sensitivity, night blindness, and so on. Total blindness. Total blindness refers to receiving no useful information through the sense of vision. In this case, a learner uses tactile and auditory senses for all learning. Total blindness is the complete lack of light perception and form perception, and is recorded as NLP or no light perception. Few people today are totally without sight. while functional blindness means having so little vision that one learns primarily through the tactile and auditory senses. However, limited vision may still be used to supplement the information one receives from the other senses. Functional blindness: a person is functionally blind when he or she has to use so many alternative techniques to perform tasks that are ordinarily performed with sight, that his or her pattern of daily living is substantially altered. Characteristics of learners with difficulty seeing. The following are the characteristics of learners with difficulty seeing, by Howard 2017. Cognition and language. Learners with difficulty seeing usually perform more poorly compared to those with normal vision in terms of cognitive tasks that require comprehension or relating various kinds of information. Because of their poor vision, it is more difficult for them to see and understand the relationships among various experiences. For instance, when they hear a dog bark, it is difficult for them to connect the sound they hear with the source, which is the dog that they could not see. This difficulty is even more emphasized when learning abstract concepts, analogies, and idiomatic expressions. More development and mobility. Blindness may also result to delays and deficits in motor development. For instance, with babies, purposeful movements involved reading for objects that they could see. Without adequate vision, the motivation of babies to perform these purposeful movements may be lessened. Vision is also important in telling the distance of objects and direction of movements. Without vision, the child may experience painful contact with the environment. Moreover, children learn a lot from feedback and from observing others. This may be limited in children with poor vision. Social adjustment and interaction. Children with visual impairment may engage in less play, which could affect their social skills development. Among adolescents, having visual impairment may increase social isolation and more effort on the part of the individual with visual impairment is needed to be able to make and keep friendships. Their condition also keeps them from benefiting from role models due to their inability to observe them. Due to their lack of vision, it also difficult for them to see and respond to social signals of others, which reduces opportunities for reciprocal interaction. Those with visual impairment are prone to develop stereotype behavior, such as repetitive body movements, including body rocking, eye pressing and poking, hand flapping, and head waving. While they usually do not cause harm, these behaviors could place a visual impaired person at social disadvantage, as they may be misinterpreted and may call negative attention to others. Furthermore, dealing with negative attitude of sighted people may also pose a challenge to individuals with visual problems. Types and causes of visual impairment. The table below shows the various types and causes of visual impairment. The first condition is the amblyopia. Amblyopia is a reduction in our loss of vision in the weaker eye from lack of use, caused by strabismus, unequal refractive errors or opacity of the lens or camera. Lazy eye or amblyopia is reduced vision in one eye caused by abnormal vision development early in life. The weaker or lazy eye often wanders inward or outward. Amblyopia generally develops from birth up to age 7 years. it is the leading cause of decreased with vision among children. Rarely, lazy eye affects both eyes. Its remarks and implications. Close work may result in eye fatigue, loss of place, or poor concentration. Sitting should favor the functional eye. The second condition is the astigmatism. Its definition and causes: distorted or blurred vision caused by irregularities in the cornea or other surfaces of the eye that produce images on. Astigmatism is a common and generally treatable imperfection in the curvature of the eye that causes blurred distance and near vision. Astigmatism occurs when either the front surface of the eye or cornea or the lens inside the eye has mismatched curves. Its remarks and implications: loss of accommodation when objects are brought close to the face, avoid long periods of reading or close tasks that cause discomfort. Child may complain of headaches and fluctuating vision. So the question is, can you go blind if you have astigmatism? Astigmatism is a problem of how the eye focuses light, typically caused by a defect in the lens, resulting in distorted images. Astigmatism is not an eye disease or health problem. While it can cause blurred vision, eye strain, and headaches, particularly after prolonged reading, but it does not cause blindness. The third condition is the cortical visual impairment or CVI. Its definition and causes: cortical visual impairment or CVI, impaired vision caused by damage to or malfunction of the visual cortex or optic nerve or both. Causes include anoxia, head injury, and infections of the central nervous system. Many children with CVI have additional disabilities such as cerebral palsy, seizure disorders, or intellectual disabilities. Cortical visual impairment or CVI is a decreased visual response due to a neurological problem affecting the visual part of the brain. Typically, a child with CVI has a normal eye exam or has an eye condition that cannot account for the abnormal visual behavior. Cortical vision impairment or CVI can be either a temporary or a permanent vision impairment caused by the disturbance of the visual cortex or posterior visual pathways of the brain. The degree of neurological impairment depends upon the time of onset and the location and intensity of the damage. Its remarks and implications: visual functioning may fluctuate depending on lighting conditions and attention. Vision usually does not deteriorate. Improvement sometimes occurs over a period of time. Some children with CVI use their peripheral vision. Some are photophobic, some are attracted to green light, may fail to blink at threatening motions. Visual images should be simple and presented singly.
By the way, I'm Joy Christine V. Lumapag. Ipagpapatuloy ko ang tinalakay ni Ms. Imbuestro na ang types and cause of visual impairment.
Ang hyperopia ay kung ang isang tao ay hindi gaanong makakita sa malapitan, subalit nakakakita ng maayos sa malayuan. Maaaring siya ay may hyperopia. Ang hyperopia o farsightedness ay sanhi ng pagkakaroon ng medyo patag na hugis ng eyeball. Sa halip na bilog ang hugis nito, ang mga unahang bahagi ng mata ay isang partikular na ang cornea at lens ay mas patag kumpara sa normal. Remarks and implications. are loss of accommodation when objects are brought close to the face. Avoid long periods of reading or close tasks that cause discomfort. Ibig sabihin na ang pagkawala ng tirahan kapag inilapit ang mga bagay sa mukha, iwasan ang mahabang panahon ng pagbabasa o pagsasara ng mga gawain na nagdudulot ng kakulangan sa ginhawa sa mata. Ang mga komplikasyon ng hyperopia, kapag ito ay hindi malulunasan, ito ay maaaring magkaroon ng iba't ibang komplikasyon tulad ng pagkaduling, palagiang pananakit ng mga mata at ulo, madalas na pagdanas ng aksidente. Paano nga ba maiiwasan ang hyperopia o pagkakaroon ng hyperopia? Upang hindi magkaroon ng anumang uri ng sakit sa mata, tulad ng hyperopia, iminumungkahing gawin ang pag-iingat tulad ng magsuot ng shades. Dahil ang pagsusuot ng shades sa tuwing mataas ang sikat ng araw ay nakakatulong upang hindi gaanong masilaw ang mga mata. Pangalawa ay ang ipahinga ang mga mata. Huwag gawing tuloy-tuloy ang pagbabasa o paggamit ng computer upang hindi mapagod at manakit ang mga mata. Macular degeneration is a central area of retina gradually deteriorates, causing loss of clear vision in the center of the visual field, common in older adults but fairly rare in children. Ang macular degeneration ay unti-unting lumalala ang gitnang bahagi ng retina na nagiging sanhi ng pagkawala ng malinaw na paningin sa gitna ng visual field. Karaniwang sa mga matatanda, ngunit medyo bihira lamang ito sa mga bata. Remarks and implications. Ang mga gawaing tulad ng pagbabasa at pagsusulat ay mahirap. Inireseta ang low vision aid o closed circuit TV. Nagbibigay ng mahusay na pag-iilaw, maiwasan ang liwanag na nakakasilaw. The next one is myopia or nearsightedness. Distant objects are blurred or not seen at all blunt. Near objects are seen clearly, caused by an elongated eye that focuses images in front of the retina. Ang myopia ay isa sa mga pinakakaraniwang sanhi ng malabong paningin ay ang nearsightedness. Ang mga malalayong bagay at teksto ay tila malabo at mahirap basahin, ngunit ang mga malapit ay malinaw na makikita. Ito ang tinatawag nating myopia o nearsightedness. Ang myopia ay isang error na refraktibo, nangangahulugang ito na ang mata ay hirap ikurba at i-focus ang ilaw ng tama sa retina dahil sa isang mas mahabang eyeball kaysa sa normal. Ang mata ay hindi kinakayang mag-focus ng maayos sa ilaw na pumapasok dito na siyang nagdudulot ng hindi malinaw na paningin sa mga bagay na malalayo. Ang pangunahing sintomas ng myopia ay isang malabo na paningin kapag tumitingin sa mga malalayong bagay. Remarks and implications. Encourage child to wear prescribed glasses or contact lens for near task. Child may be more comfortable wearing glasses and bringing work close to face. Next is nystagmus. Rapid involuntary back and forth movement of the eyes, which makes it difficult to focus on objects. When the two eyes cannot focus simultaneously, the brain avoids a double image by suppressing the visual input from the eye. The weaker eye can actually lose its ability to see. Can occur on its own but is usually associated with other visual impairments.
Remarks and implication of nystagmus or close task for extended period can lead to fatigue. Some children turn or tilt head to obtain the best focus. Do not criticize this. The last one is strabismus. Strabismus is inability to focus on the same object with both eyes because of an inward or outward deviation of one or both eyes caused by muscle imbalance secondary to other visual impairments. Strabismus ay ang kawalan ng kakayahang tumugon sa parehong bagay gamit ang parehong mga mata dahil sa panloob o panlabas na paglihis ng isa o parehong mga mata. Sanhi ito ng kawalan ng timbang ng kalamnan, pangalawa sa iba pang mga kapansanan sa mata. Remarks and implications of strabismus in classroom setting should favor students' stronger eye. Some students may use one eye for distance tasks and the other eye for near tasks. Frequent rest periods may be needed during close work may need more time to adjust unfamiliar visual tasks. Identifying learners with difficulty seeing. There are a number of indicators of visual impairment that parents and teachers need to be aware of. These indicators may be observed from the student's eye appearance and complaints when using eyes during desk work. There are also behavioral signs such as deficits in eye-teaming abilities, eye-hand coordination, visual from perception, as well as refractive status indicating visual impairment. In the term of eye appearance, turning of one eye in or at any time, widening of eyes or lids, excessive tearing of eye, having encrusted eyelids or frequently developing styles on lids could be sign of developing eye and visual problems. There are also behavioral signs indicating visual problems. For instance, deficits in eye movement abilities could signal visual impairment. Mayroon ding behavioral sign na nagpapahiwatig ang mga problema sa paningin. Halimbawa, ang mga kakulangan sa kakayahan sa paggalaw ng mga mata o ocular motility ay maaaring magpahiwatig ng kapansanan sa paningin. Other behavioral indicators of visual impairment include deficits in eye-hand coordination abilities, problems with refractive status, may also be inferred from behavioral indicators of visual problems.
Hello everyone, good day. I'm Arika Gibrabaneria, your next reporter. And now we talk about the Snellen chart. Everyone is familiar with the term 2020 vision. It is now part of our vernacular. There are companies called 2020 Travel and so forth. 2020 is considered a measure of perfection and also a measure of visual acuity. The Snellen chart is used to test visual acuity. It was developed by a Dutch ophthalmologist in 1962 and is still used tool in measuring visual acuity today. It consists of rows of letters which each row corresponding to the distance that a normally sighted person could discriminate letters. So ang Snellen chart amo po anso to test your visual acuity and to know how serious your problem in eyesight. Visual acuity or VA is a measure of the ability of the eye to distinguish shapes and the details of objects at a given distance. It is important to assess VA in a consistent way In order to detect any changes in vision, one eye is tested at a time. Types of visual acuity. Spatial acuity. Spatial from the word space, ability to resolve 2 points in space. It's also defined as the highest visible spatial frequency. It is a function of brightness, as is using Snellen chart, which contain square letters of the alphabet. So, adi po is, ito po yung to test your eye. Kung gaano kalayo at kung mababasa mo yung Snellen chart. Ito po yung tinatawag na Snellen eye chart. At meron po siyang dalawang acuity, the low acuity and high acuity. Standing at 20 feet or 6 meters can only resolve letters that normal population can resolve at 200 feet or 20 over 200. High acuity is standing at 20 feet centimeter. Resolve a letter that the normal population can resolve at 15 or 20 over 15. And number 2 types of visual acuity is temporal acuity. Temporal acuity is ability to distinguish visual events in time, defined as the minimum detectable gap in an otherwise continuous noise was measured with an adaptive version of the two alternative force choice tasks. Is the boundary between contrast you can see and you cannot see. So number 3 is spectral acuity, ability to distinguish visual events, difference in the wavelengths of the stimuli. Example is from light color to dark color. The normal eye is able to discriminate between light of shorter or longer wavelength within the visible spectrum. It may be defined as an energy to which human eye is sensitive. Spectral is from the word relating to a specter or resembling or suggesting a specter, like that. The Vision Services Severity Rating Scale, or the VSSRS, it was developed by Michigan Department of Education 2013 in order to assist the teacher consultant for the visually impaired, or the TZVI, or teacher of the visually impaired, for use with students in general education settings and may be applicable for some students with additional blind impairments. So the VSSRS is the making recommendation for services to students who are blind or visually impaired. Para po yun sa mga taong malabo yung mata or blurred na po yung pagtingin. At gumagamit po sila ng mga recommendation or services para sa mga taong yun. And VSSRS support consistency in determining services delivery times for students who are blind or visually impaired. Use the scales to establish how often a particular service should be delivered to a student, like what I said. For more information about VSSRS, please refer to Michigan Department of Education 2013 in the references. Table 6.2 Vision Services Rating Scale, or the VSSRS Revised 2013 Severity of Need Profile. At ito po yung kailangang fill upan ng mga taong impaired or may problema sa mata. Student or name. birth date, grade or program, and date kung kailan. Sa table po makikita ninyo ang severity of needs, none or 0, mild 1, moderate 2, severe 3, profound 4. Sa severity of needs, level of vision medical, number 1, distance acuity. Ito po yung kung gaano kalayo mababasa ng person ang kailangan niyang basahin or ang ipapabasa sa kanya. Sa none or 0, there have 2/40 to 20/70. Sa mild, 20/70 to 20/100. Moderate, 20/100 to 20/400. Severe, 20/400 to count fingers. Profound, light perception to NIL. Number 2 is peripheral field. So none, 0, full field. Mild, 90 degree to 30 degree field. 30 degree to 10 degree field is the moderate. Severe, 10 degree field or less. Profound, no field. Ang peripheral field po is the outer part of the field of vision, specifically the part that lies more than 30 degrees from the line of the sight. Then number 3, functional new vision, the appendix A. To none, reads 9 to 12 point font. Sa mild, reads 14 to 18 point font. Moderate, reads to 20 to 26 font. Severe, reads 28 to 36 point font or larger. Profound, unable to read free. Then, reading medium. None, regular print reader, proficient, braille reader, or pre-reader. Mild, large print reader. Moderate, print needs vary, occasional modifications needed, or the CCTV magnifier, or etc. Several dual reader mediums, print braille, auditory. Profound, learning new reading medium or the braille, auditory, technology, and etc. Then, low vision devices or technology. So no instruction needed. Mild mastery of devices or limited instruction. Moderate review or refine skills using existing devices. Instruction of technology, equipment skills, or note taker, screen reader. Yan po yung profound. Instruction in additional functions of existing devices is the severe. So, the low vision devices, ito po yung the task specific designed for close-up visual tasks or distance viewing. You may require several different devices to accomplish different tasks depending upon your eye condition and your everyday living needs. Number 6, material preparation. None is none. Okay. Mild is occasionally preparation and modification needed. Moderate, monthly preparation and modifications needed. Severe, weekly preparation and modifications needed. Profound, daily preparation and modifications needed. Then number 7, compensatory skills. None, no instruction needed. Mild, occasional instruction and input needed. Moderate, monthly instruction and input needed. Severe, weekly instruction and input needed. Profound, daily instruction and input needed. Then, communication with the students' team or pertinent individuals. This is the last one. None, student successfully advocates for self. Mild, occasional communication necessary. Moderate, monthly communication necessary. Severe, weekly communication necessary. Profound, daily communication necessary. The communication with the students or the team or pertinent individuals is a person you can go to for help or advice or information. So Table 6.3, Vision Services Severity Rating Scale or the VSSRS, Severity of Needs Summary. Ito po yung kailangan fill upan ng mga taong may damage yung mata or blurred na yung pagtingin or malabo. Student or the name, birth date, grade or program, or date. And sa table, makikita po ninyo the contribute factors to services delivery. If appropriate, add 5 or subtract 5 for each. Number 1, age of students. Number 2, attendance. 3, availability of materials or equipment. 4, expanded core curriculum. Brief instruction or coordination. 5, progressive coordination. 6, recent vision loss. 7, school staff need for support. 8, student cooperation. 9, training of professional or teaching assistants or brailless. Transition to new school or building. Travel time. Numerous accommodation provided by TZ-V1 or TB1. Direct curriculum instruction. Add 1 to 4 prints or other explaining. Itong table po ito po yun is to measure the severity need, an analysis, observation, and to know the results that will need to be studied more. And sa baba po ng table, makikita po ninyo the severity of need score, contributing factors, positive or negative, final severity of need score. At para po malaman ninyo yung score, ito po yung kailangan. Severity of need score and the frequency of service. 0 to 2, service not indicated. 3 to 5, 1 to 5 times or year. 6 to 8, 3 to 4 times or semester. 9 to 13, 1 to 3 times or month. 20 to 60 minutes each. And 14 to 23, 1 to 2 times or week. 30 to 40 minutes. 24 to 32 is 4 or more times or week. 45 or more minutes each. Ito pang table is adapted for Texas with the approval of Michigan Department of Education. Low incidence Dotrich. And sa baba po ng table, may makikita po kayong recommendation of services, the final severity of needs score, and frequency of services.
Good day everyone! So I am Linal Ashley D. De La Cruz, and for this video, I am going to tackle about the learners with difficulty in hearing. So, as you can see on the slide po, there is a figure 6.2, the decibel scale. Nakita nyo po yung picture sa slide na merong iba't ibang categories or levels ang decibel scale. So, what do we mean by decibel? So, decibel is the degree of loudness na ating naririnig. So, it is starting from the 0 dB up to 140 dB. So, nakikita nyo naman po sa picture and self-explanatory naman po siya and nakalagay din po dun kung ano yung normal na dB or decibel scales ng isang tao and ano yung pinakamalakas para sa ating tenga. So, ginagamit po ito para ma-determine kung meron ba tayong problema sa ating tenga. So, it is used by the audiologist to identify if that person is merong impairment through his hearing. So, audiologist, sila po yung nag-e-examine sa atin no mga baby pa po tayo kung meron tayong mga problema sa ating tenga. So, ang ginagamit nila is the decibel meter, if I am not mistaken. So, meron po siyang parang earphone po siya and parang may gadget na ganito, parang box na maliit na square. And then, meron siyang makikita doon, lalabas kung ganong dB or level ng hearing ang naririnig ng isang baby. So, pinapasok po siya sa tenga. Pero, para siyang hearing aid. Nilalagay po siya sa tenga. So, important terms related to learners with difficulty hearings. First is the deafness. Is defined as severe hearing loss in that learner is impaired in processing linguistic information through hearing with or without amplification and which negatively affects a learner's educational performance. So, when we say deafness, ito po yung severe hearing loss or pagkawala ng panrinig. So, this is common to the persons na mga matatanda na or yung mga taong inborn na walang pangrinig, just like yung sa akin, yung sa impairment ko, wala akong pangrinig sa kabilang side ng aking tenga. And then, this can be also developed or inherited or through time passed by dahil sa kung anong infections ang meron sa tenga. So, second is the hearing loss. It pertains to loss in hearing, whether permanent or fluctuating. So, fluctuating is yung paiba-iba yung level ng loudness na naririnig that negatively affects a learner's educational performance other than those that quality as deafness. So, you must be wondering, parang parehas naman yung deafness tsaka hearing loss. Yes, parang they are the same, but the thing is, ang pinagkaiba naman po nila is that the hearing loss, this is a reduced ability to hear sounds in the same way as other people. It means yung hearing loss po, nababawasan lang po yung abilidad ng isang tao na makarinig ng mga noise sa paligid or ng mga conversation. So, the next thing is, paano naman yung deafness? So, when we say deafness naman, this occurs when a person cannot understand speech through hearing even when sound is amplified. So, ibig sabihin, kahit anong noise ang nandyan, kahit ano yung sabihin nung nakikipag-usap sa kanya, kahit anong tunog, hindi niya yun maririnig. Kasi deaf means wala na talaga. Ano na siya, block na yung noise na pwedeng marinig ng tenga natin. Number 3 is the residual hearing, refers to some sounds perceived by most deaf people. So, ang ibig sabihin naman po ng residual hearing, it is the ability to hear some sounds if a hearing loss exists. So, kahit deaf na or impaired na when it comes to hearing ang isang tao, meron at meron pa rin siyang nava-vibrate or naririnig. So, number 4, hard of hearing are those who can use their hearing to understand speech, generally with the help of hearing aids. So, hard of hearing, ito po yung mga nahihirapan na magsagap ng mga sounds or makarinig. Katulad po sa akin, yung sa other side po ng ear ko is wala na po siyang naririnig, pero yung other side naman po, yung right ear ko naman po is very hard to hear, na kailangan pa talagang lakasan yung pagsasalita or lakasan ko yung volume just to understand kung ano yung sinasabi or ano yung noise na nasa paligid ko. So, itong hard of hearing is ito yung may mga condition sa mga tao na kailangan na din nilang gumamit ng hearing aid just to hear clearly kung ano yung mga sounds na nasa sagap ng tenga. So number 5 is the deaf culture. Prefer terms such as teachers of deaf, school for the deaf, and deaf person. So deaf culture, ito yung culture ng mga deaf people. It is the set of social beliefs, behaviors, art, literacy. Dito pumapasok yung paggamit ng mga sign language and anything that describes or practices the deaf or the behavior of deaf people. The important terms related to sound. What are the words na correlated when it comes to hearing or sound? First is the decibels. Refers to the intensity or loudness of sound, kung gaano kalakas yung isang sound na ating naririnig. Second is the zero hearing. Threshold level is the small sound a person with normal hearing can perceive, also called the audiometric zero. So, itong zero hearing, ito yung level na pinakamababa or pinakamaliit na sound na naririnig ng isang normal na tao sa naririnig niya through his or her environment. It is also called audiometric zero. Number 3 is hertz or Hz kapag sinulat. It pertains to the frequency or pitch of the sound. Kung ano ba yung frequency, ano yung pitch ng sound na naririnig natin. Characteristics of learners with difficulty hearings. So first is the literacy. Learners with hearing loss are at a great disadvantage of acquiring language skills. It is because we can adopt new vocabularies, new learnings, new knowledge through hearing. So when the person have this hearing impairment or have the difficulty in hearing, he or she cannot adopt easily on what are the words, what are the new vocabularies, or kung ano man yung sinasabi ng teachers na nasa unahan, kasi nahihirapan siyang mag-adapt sa kung ano yung sound na nasasagap niya. Second one is the speaking. It is common for children who are deaf and hard of hearing to have atypical speech. So, aside from having difficulty learning a language, they also could not hear their own speech. Yun nga po yung sinasabi ko na when you have a difficulty in hearing, just like in my case, nahihirapan akong i-identify kung gaano kalakas yung boses ko, kung gaano kahina yung intensity, yung speech, kung pumipiyok ba ako or sumisigaw na ako. It is because we cannot hear normally just like you na mayroong normal na pagrinig. So, hindi namin alam kung masyado na bang malakas yung boses namin. Hindi namin yun nanonotice sa mga sarili namin. And also, sa pagsasalita, hindi agad nakaka-adapt ng language or ng mga words yung mga taong merong difficulty in hearing kasi nga nahihirapan kaming makinig or makarinig. Number 3 is the academic achievement. Students with difficulty hearing usually perform poorly than their peers with normal hearing. It is because hindi naririnig ng maayos, syempre hindi mo agad matututunan yung isang bagay or yung naririnig mo. Just like for example, a scenario sa loob ng school. Kapag nagsasalita yung teacher and then yung learner merong difficulty in hearing and then nasa medyo last row na siya ng upuan, syempre hindi niya ma-adapt yung sinasabi ng teacher, and it resulted to academic achievement na hindi gaano performantly active or hindi gaano kaganda yung academic achievement niya. Number 4 is the social functioning. Hearing loss may result in feelings of isolation, having no friends, and unhappiness in school, as this limits socialization with peers. So, it is because they can form behavioral difficulties. Kapag meron kang pagkukulang sa'yo, syempre, isolate mo yung sarili mo. Like, there are times na may insecure ka sa ibang tao, diba? Lalo na kung may difficulty in hearing ka, just like mine, I become insecure way back then, na kung saan, mas gusto kong i-isolate yung sarili ko, and nililimit ko yung socialization with other people, kasi kung may ibubulong sila dito sa left ear ko na wala naman ako naririnig, sige, ganun lang. Oo, naintindihan ko. Pero yung totoo, hindi naman. So, di ba, nakakahiya na ganun. Ikaw binga, ganun. Gusto sabihin pa nila. So, you are limiting yourself towards socializing with other people. The types and causes of hearing loss. The following are the different types of hearing loss according to Hayward in 2017. So, first is the conductive hearing impairment. It involves a problem with the conduction or transmission of sound vibrations to the inner ear. So, this conductive hearing impairment is an impairment where the sound cannot through or cannot pass by to the outer and the middle ear. So, it can be, pwede siyang magamot through surgery and taking medication. The second one is the sensory hearing impairment. This refers to the damage to the cochlea. So, the cochlea naman po is the spiral part ng ating ear, which is, siya naman yung nagpa-process or nagse-sense ng mga naririnig natin na sound. So, it happens after inner ear damage or nasisira yung inner ear natin. So, the third one is the neural hearing impairment. This refers to the abnormality of the auditory nerves pathway. So, ito naman yung abnormality niya dun sa auditory nerves pathway is hindi nagpa-function ng maayos, that resulted to back and forth or paiba-ibang sounds na naririnig sa tenga. The fourth one is the mixed hearing impairment. This refers to any combination of conductive, sensory, and neural hearing loss. So, mix, halo-halo na kahit yung conductive, sensory, naghalong impairment, or yung neural hearing loss, or yung sensory hearing impairment na pinagsama. That is what we call the mixed hearing impairments. The next one is the unilateral hearing loss. This is hearing loss in one ear. So, just like in my case, I have this unilateral hearing loss, or isa lang sa mga tenga ko ang hindi nakakarinig. Completely 0 dB. Wala talaga siyang naririnig. So, ang left ear ko is walang naririnig, but my right ear ko is somehow okay pa naman, pero meron na din siyang hearing impairment. So, maraming factors na nakaka-affect kung paano nagkakaroon ng unilateral hearing loss. So, next is the bilateral hearing loss. Thus, is hearing loss in both ears. So, pag unilateral, isang tenga lang ang hindi nakakarinig, but on the bilateral, it means two. Yung both ears mo is hindi nakakarinig. The next is the congenital hearing loss. This is hearing loss present at birth. So, congenital. So, since nung pinanganak pa lang, wala na talagang pangrinig. So, yun din yung isa sa mga causes ko kung bakit ako nagkaroon ng unilateral hearing loss. It is because yung left ear ko is congenital na wala na talagang pangrinig. So, Next is the acquired hearing loss. This is hearing loss that develops after birth. So, acquired hearing loss, ito naman yung na-acquired or it can be developed by the some accidents, some infections in the ears that causes this acquired hearing loss. The last one is the prelingual hearing loss. This is a hearing loss before the development of spoken language. So, nadidevelop ito. It can be developed before we acquire or develop our spoken language. This is from 1 to 2 years old, I guess, kasi hindi pa tayo dun gaano nakaka-develop ng mga language or hindi pa tayo dun nakakapagsalita sa stage na yon. On this slide, we can see the table 6.4, the possible causes of hearing loss. So, what are the causes in having this hearing loss? So, on the first column is the congenital, genetic factors. So, when we say genetic factors, it is correlated to the genes. So, dito naman sinasabi dito na ang hearing loss and the genetic factors can be acquired or adopted through the parents. So, kung yung one of the parents ay mayroong history of having hearing impaired, then it can be adopted through the genes of the parents and then mapunta sa anak na kung saan nagre-result ng hearing loss. The second column is the acquired, the otitis media, a temporary recurrent infection or of the middle ear. It is an inflammation or infection located in the middle ear. It is caused by fluid trapped behind the eardrum, which causes the eardrum to bulge. And then, it can occur or pwede siyang mag-result sa cold, sa sore throat, or sa respiratory infection. But this can be, pwede siyang magamot through medication of taking antibiotics. The second one is the meningitis, a bacterial or viral infections of the central nervous system, and is the leading cause of postlingual hearing loss. So, it includes the loss of hair cells in the inner ear or sa loob ng tenga natin, which leads to mild to medium hearing loss. Further physical damage of inner ear structures can cause a profound hearing loss. Meningitis can also leave a person with tinnitus, a persistent whooshing or ringing in the ear sound. So, this is a type of hearing loss that is a permanent. Kapag nagkaroon ka ng meningitis, hindi na siya nagagamot. On the first column again, under the congenital, we have the maternal rubella. When a pregnant woman contracted rubella, which could cause deafness in the developing child. So, basically speaking, this maternal rubella is an illness in infants that results from maternal infection with rubella virus during the pregnancy of a mother. When rubella infection occurs during early pregnancy, serious consequences such as miscarriage, stillbirths, and a constellations of severe birth defects in infants can result. So, this is occurred when a mother has a rubella virus during her pregnancy, na-adapt yun ng baby. And the second one is the congenital cytomegalovirus, when a woman contracts cytomegalovirus, which risks deafness in the developing of child. So, this condition can occur when an infant is infected with a virus or the so-called CMV. So, before birth po siya. Ibig sabihin, this condition is present at birth. And the last one sa congenital is the prematurity. So, ito yung mga baby na 6, 7 or 8 months pa lang is nilalabas na sa womb ng mga nanay nila due to some reasons, and yun nga, mga premature baby is not fully developed ng mga parts, ng mga senses. So, ito, nagkokosto ng hearing loss. And on the second column is the acquired. So, we have here is the Meniere's disease. This is a sudden and unpredictable attacks of vertigo, fluctuations in hearing, and tinnitus, perception of sound when no outside sound is present. So, this is a disorder sa inner ear po that can lead to dizzy spells, sa vertigo, and hearing loss. In most cases, Meniere's disease affects only one ear, or the so-called unilateral hearing loss. Meniere's disease can also occur at any age, but it is usually starts between young and middle-aged adulthood. And then the last one, that or one of the reason that we can acquire the hearing loss is due to noise exposure. So this is the repeated exposure to loud sounds. So kung sobra na yung sounds, masyado na yung frequency, yung intensity, masyado na yung malakas yung loudness ng sounds na naririnig natin, we have to be careful kasi nagkukos yun ng pagkasira ng ating eardrum, and which can lead to hearing impairment or hearing loss. Here in this slide, the table 6.5, the classification of hearing loss. So in the first column, we can see the degree of hearing loss. What is the degree of hearing loss? On the second column is the classification of that degree of hearing loss, and then the impact on speech and languages or language in the third column. So 27 to 40 decibel, this is a slight lang siya when it comes to hearing loss. The impact of this is no difficulty understanding speech in quiet settings, but noisy environments pose problems to learning. The second one is it may benefit from favorable setting and sound field amplification. The second one is the 41 to 55 decibels. This is a mild classification, and the impacts are: it can understand face-to-face conversation with little difficulty, misses much of classroom discussion, particularly when the speaker cannot be seen clearly or several students are speaking at once. The third one is may have some classmates who are unaware that he or she has a hearing loss. And second to the last is the benefits from a hearing aid, and the last one is the most benefit from speech and language assistance from a speech language pathologist. The next one is the 56 to 70 decibel, which is its classification is moderate. So what are the impacts of having this moderate hearing loss? So the person or the learner without hearing aid can hear conversational speech only if it is near, loud, and clear. The second one is it find it extremely difficult to follow group discussions. Third one is full-time amplification is necessary. The fourth one is the speech noticeably impaired but intelligibly. And the last one is many benefit from time in a special class where intensive instruction in language and communication can be provided. 71 to 90 decibels, This is the severe classification. So the impacts are the learners or the person can hear voices only if they are very loud and 1 foot or less from the ear. The second one is wears a hearing aid, but it is unclear how much it helps. The third one is it can hear loud sounds such as slamming door, vacuum cleaner, and airplane flying overhead. The fourth one is may distinguish most vowel sounds but few if any consonants. The fifth one is it communicates by speech and sound and sign or the sign language. And then the last one is it may split alcohol day between a special class and a general education classroom with an educational interpreter or this shadow teacher. The last one or the profound classification is in the degree of hearing loss of 91 decibels or more or pataas. The impacts are the learners or person cannot hear conversational speech. Second is hearing aid enables awareness of certain very loud sounds such as a bass drum. The third one is vision is primary modality for learning. The fourth one is American Sign Language, likely to be the first language and principal means of communication. The fifth one is it has not developed intelligible speech. And the last one is the most require full-time special education program for students who are deaf. So, basically speaking, this 91 decibels or more or the classification of profound hearing loss, ito yung mga tao ng sign language na lang yung ginagamit nila to communicate with other people, and it is very hard nang makipag-usap sa kanila or makipag-communicate. Identifying learners with difficulty hearing. So, how can we identify the learners na mayroong difficulty or mayroong paghihirap sa pagrinig? So, identifying learners with hearing problems may be challenging for parents and teachers. It can be mistaken as another problem and may be diagnosed. For example, is the attention deficit disorder or the ADD, especially if hearing loss is unilateral or it can go undiagnosed and thus may affect a student's learning. A number of indicators that may signify hearing difficulties which teachers and parents need to pay attention to have been identified by the People Hearing Better in 2014. The following table describes the signs that indicate a child has hearing problems. So, on the next slide, makikita natin yung mga signs na nag-indicate kung yung isang bata ba or yung isang tao ba ay mayroong hearing problem. So, it is very hard to identify kung yung isang tao ba ay mayroong difficulty when it comes to hearing because there are certain types, there are different types, different characteristics ng hearing loss. So, we cannot say na ay isa lang naman yung nakakarinig sa kanya, so okay lang naman, parang normal siya. But it is not, because it is one of the insecurities din ng mga learners na mayroong hearing impairment or hearing loss. Table 6.6, signs that a child has hearing problems. So in this slide and to the upcoming slides, we are going to study furthermore about the signs that a child can have a hearing problem or he or she has a hearing problem. So first is the speech problems. some of the speech problems which can be due to hearing difficulty are inability to say words correctly, delays in language learning and communication, and opting to use nonverbal gestures over verbal communication. Because a child with hearing difficulty cannot hear what another person is saying properly or cannot process sounds properly, speech learning can also be affected. However, a lisp, which a common speech disorder, is usually not an indicator of hearing problems. So, here, a child can be identified na mayroong hearing problems through the speech problems. When a child or a learner doesn't communicate well with other people or cannot say words properly, kung hindi niya nasasabi yung mga words ng maayos or yung gusto niyang sabihin, hindi niya nasasabi ng direct to the point or ng maayos, it is because of speech problems. And one thing more is if a child or a learner uses nonverbal communication, mas gugustuhin niyang mag-sign language or magpasabot, 'di ba? Yung parang magpasabot ka na lang kesa sa verbal communication or sa sasalitain niya kung ano yung gusto niyang iparating sa iyo. The second one is the inattentiveness. When a child does not respond when being called, it could be a sign of hearing difficulty. In order to differentiate selective hearing, deliberately not responding, which is common among children, from a genuine hearing problem, we have to look at the consistency. If it happens repeatedly and the child looks confused, is slow to answer, answers incorrectly, or asks things to be repeated, it could be indicators of hearing difficulty. Moreover, if a child needs to look directly at another person in order to understand what is being said, it might indicate lip reading and thus may also be a sign of hearing problems. So, here in the inattentiveness, sinasabi dito na a child or a learner can identify as or having the problem with hearing kapag inattentive siya or hindi siya attentive when it comes to pag tinatawag siya, hindi siya agad tumitingin or hindi siya agad nagre-respond and multiple times na siyang tinawag but wala pa din na respond sa nagaling sa kanya. And then pwede din ditong pumasok yung kapag yung bata or yung learner is nagkakaroon ng difficulty sa kikipag-usap na kung saan he or she pardon or ask to repeat that person what is saying kasi hindi niya naiintindihan or nagkakaroon ng fluctuating sa mga words or sa communication. The next one is the increasing volume. If a child puts the volume on the television, radio, or computer to high, or if he or she speaks louder than most children, this could also be indicative of hearing problems. This is usual for children with unilateral hearing loss, which is more difficult to detect since the hearing ear usually masks but does not compensate for the lack of hearing in the problematic ear. If undetected, unilateral hearing loss could lead to the same cognitive delays as in those with bilateral hearing problems. So, here naman, an increasing volume, if a child or if a learner wants to increase na sobrang lakas yung pinapakinggan niya or yung pinapanood niya, that's one of the sign na mayroon siyang hearing problems. It is most occurring or on the cases na mayroong unilateral hearing loss. So, that's my case, the unilateral hearing loss, and yes, talagang pinapalakasan namin yung mga volume ng aming pinapanood or pinapakinggang. It is nagfa-fluctuate yung mga sounds na naririnig namin. It's either in communication or in the surroundings or environment sounds na aming naririnig. Nagbabago-bago siya and hindi namin siya gaanong naiintindihan. May times na lalakas, bigla na lang hihina, and isa pa din dito yung kung gaano kalakas yung boses ng bata or ng isang learner. If he or she louds her or his voice na sobrang lakas na, and then hindi niya nanonotice, just like me, diba? If you know me, you know how much loud or how loud my voice is kapag nagsasalita. It is because I cannot determine kung gaano ba kalakas yung boses ko kapag nagsasalita ako. And the next one is the not following directions. Children with hearing difficulty also have difficulty with language and thus may be confused by direction when I find it difficult to follow directions or consistently ask for instructions to be repeated. Moreover, because of language difficulties of those with hearing problems, they may they may also have trouble expressing themselves. So, ang mga children or learner that has a hearing problems, they cannot follow instructions properly. It is because they cannot hear properly nga. So, nagfa-fluctuate nga. Just like what I said earlier and repeatedly, nagfa-fluctuate yung words, yung volume, yung mga naririnig namin. So, nako-confuse kami doon sa kung ano ba talaga yung gustong iparating nung kausap namin or kung ano ba yung directions na sinasabi sa amin. Learning difficulties. Another sign of hearing problems is when a student experiences learning problems in school. For instance, a teacher may complain that the student does not pay attention, does not listen, ignores or does not follow instructions, or does not respond, or find it difficult to keep up with conversations. Also, learners with hearing problems find it more difficult than other children to learn various aspects of verbal communication such as vocabulary, grammar, word order, and idiomatic expressions. So, as I've said earlier, the characteristics of learners with having difficulty in hearing is the literacy or the learning difficulties. Hindi sila nakakasabay masyado sa kung ano yung pinag-aaralan sa isang classroom. It is because kulang nga yung kulang yung pangrinig nila, hindi nila maayos na naririnig kung ano yung tinuturo. That results to learning difficulties and nagkakaroon ng hindi maayos na performance sa school. And the last one is the social withdrawal. Individuals with hearing problems tend to avoid social situations and thus may not participate in activities such as sports, parties, or even family gatherings. Their difficulty communicating with others may overwhelm them, and due to their communication difficulties, they may find it difficult to explain it to others. For young children who grew up with hearing problems, they may find the situation normal and they may be unaware of their problem, which makes it even more difficult for them to understand their situation and explain it to other people. So, a child or a learner with hearing problems tend to withdraw themselves socially. So, when it comes to withdrawal, nagkakaroon sila ng barrier doon sa socialization or socializing with other people. Hindi sila nakikisama or iniisip nila they are not belong, kaya they tend to withdraw themselves socially. Kasi may hirapan din silang i-explain kung ano yung situation nila. And lalo na yung mga SPED na mayroong deafness talaga na kung saan wala talaga silang naririnig, sobrang hirap sa kanila na makipag-communicate, lalo na kapag yung kausap nila is walang knowledge or he does not even know how to use the sign language. So, wini-withdraw na lang yung sarili nila sa pakikipag-socialize with other people. Assessment of hearing loss. The following are the different ways of hearing loss is assessed according to Howard in 2017. Assessment of infants. The following table shows the expected auditory behavior during the baby's first year. So, Table 6.7, expected auditory behaviors during the first year. So, ano nga ba yung inaasahan or dapat asahan na marinig na ng mga bata during the first year or 1 year old, infant to 1 year old? So, in the age of birth month to 3 months, the expected auditory behavior are parties to loud noises, cause and mix pleasurable gurgling sounds, or ito yung pagtawa, marunong na siyang mag-giggle, turns to voices, quiet downs or smiles when spoken to, steers or awakens from sleep to a loud sound relatively. So, this is very makakarelate ako dito kasi yung anak ko nung baby pa siya talaga, up to pagkapanganak sa kanya, up to 3 months niya, talagang nagpo-progress na doon na siya nag-start mag-giggle. Siguro mga 1.5 month, marunong na siyang makilaro, marunong siyang pag narinig niya yung sounds, nakikiabrakan na siya, yung nakikipagkulitan na siya, and then yung parang nakakapagsabi na siya ng words na sabi dito, turns to voices, parang parang ganun, parang nag-hum or may nasasabi siya, and then nag-i-smile na siya kapag may nagsasalita, and then nagigising siya pag sobrang lakas na ng ingay. That means is malakas yung pangrinig niya or normal yung pangrinig niya. So, next, in the age of 4 months to 6 months, so the expected auditory behavior are at engage in vocal play when alone, or gurgles, tumatawa, bubbles with speech-like sounds, turns eyes toward direction of sounds, laughs, and chucky. So, in 4 to 6 months, yung mga baby is nakakipagkulitan na sila, and nakakakita na yung mga baby. So, the auditory behavior dito is kapag nakakapaglaro na siya mag-isa, yung kahit may makita lang siyang laruan, or katulad kay Adria na may makita lang siya na laruan doon sa taas ng crib niya, nag-aano na siya, parang may nasasabi na siyang words or tumatawa na siya mag-isa, and then nakakapagsabi na din siya ng hindi naman nakakapagsabi, parang may lumalabas na mga parang words or sounds sa bunganga niya, and then sumusunod na yung mata niya kapag nakikipag-usap kami sa kanya, and then nagtatawa na siya ng sobra and nakikipaglaro or nakikipagharutan. And in the 7 months to 1 year old na child, the expected auditory behavior are it responds differently to a cheerful voice versus an angry voice. So, dito nakaka-recognize na yung bata kung galit ba talaga yung boses mo or hindi. And then, nakaka-adapt na sila kung ano yung gagawin nila pag nakakarinig sila ng masyado high pitch na voice. So, nakaka-determine na sila dito. And then, the second one is it responds to music or singing. So, to be honest, si Adriana, yung baby ko, during her 11 months or 10 months to 12 months niya or 1 year old is kapag nagpapatugtog ako ng music, yun, kasi mahilig ako magpatugtog ng music, and then parang na-identify niya na, and then when it comes repeatedly, nag-enjoy na siya, and then eventually hinahanap-hanap niya, and at the same time sumasabay na siyang sumayaw or mag-sway-sway ng katawan niya through the music na naririnig niya. So, nakakarinig siya pag ganun ang bata. Third one is vocalized emotions. So, nakapag-vocal na sila ng emotion nila, kung galit sila through facial expression din, and then through mga words din or mga pasabot nila. Bubbling acquires infection and contains short and long groups of speech sounds like tata, up, bibi, yes, but ang mga bata ay mayroong iba't ibang stages or iba't ibang pagkakataon na kung saan doon sila magde-develop ng mga salita. And yes, dito nag-i-start yung short and long groups of speech sounds. Doon yan nasasabi yung mama, lola, lolo, yun din na nakakapagsalita kapag 1 year old na. And then, kung ano yung sabihin namin is parang na sasabayan niya na, but hindi clearly. The next is, it tries to imitate the speech sounds of others. Yes, ang mga bata po, kapag may naririnig sila na sounds, is ini-imitate nila or ginagaya nila kahit hindi nga clearly. Gagayahin talaga nila yan. Next is, it turns head in the direction of the source of a sound. So, lilingon at lilingon yung batang yan kapag may narinig na sound. Next is thesis activity when parent's voice is heard. So, yes. So, si Adriana, kapag nakakarinig siya ng boses ko, ng boses ni mama, ng boses ni tita, eventually, parang parang magiging genuine na yung mukha niya, matutuwa na siya, yung ganun. And then next is responds to own name and requests such as want more or come here. So, 7 to 1 year, ang mga bata is nakaka-recognize na kung anong pangalan nila. Kapag tinawag mo Adriana, titingin din naman siya, and then she is, kasi, mga 11 months pa lang talaga, nakapaglakad na siya. Mas nauna pang ma-develop yung walking niya instead of talking niya. So, dun pa lang kapag tinatawag na namin siya, lumalapit na siya, it means that she is having a active auditory behavior. So, next is, it uses a few words, mama or dada, doggy, by first birthday. So, as I said a while ago, nakakapagsalita na yung mga bata and 1 year old ng mama, dada, lolo, lola, kapag pinagaya nyo sila. In this slide, we have the types and causes of hearing loss. First is the pure tone audiometry. It is used to assess the hearing of older children and adults by determining how loud sounds at various frequencies must be for one to hear them. An audiometer meter is used, which is an electronic device that generates pure tones at different levels of intensity and frequency. The results are plotted in an audiogram. So this pure tone audiometry is the main hearing test used to identify hearing threshold levels of an individual, enabling determination of the degree, type, and configuration of a hearing loss, and thus providing a basis for diagnosis and management. So, it is an instrument na ginagamit para ma-determine kung ang isa bang tao ay mayroong hearing problem. So, dito din pagbabasihan kung ano yung diagnosis and paano mamamanage yung hearing loss na nakita sa isang tao. The second one is the speech reception test. It tests a person's detection and understanding of speech sounds. Phonetically balanced one and two syllable words are presented at different decibel levels, and the speech reception threshold, or the lowest decibel level at which one can repeat half of the words listened to, is measured and recorded for each ear. So this is used, or it tests on how you will listen well and repeat words. Tinetest niya yung speech reception threshold. This is used for older children and adults who can talk. The results are compared to pure tone test results to help identify hearing loss. The third one is the alternative audiometric techniques. It includes play audiometry, in which the child is taught to perform simple but distinct activities whenever one hears the signal speech or pure tone. Operant conditioning audiometry, in which the child receives tokens when a button is pushed in the presence of a light paired with the sound, and behavior observation audiometry, which is a passive assessment procedure in which the child's reaction to sounds is observed. So basically this is consists of different tests of function of the hearing mechanism. This includes tests of mechanical sound transmission sa middle ear function, the neural sound transmission, and speech discrimination ability, and the central integration. A complete evaluation of a patient's hearing must be done by trained personnel using instruments designed specifically for this purpose. So, here naman sa alternative audiometric techniques, sinasabi dito na ito po ay consist of different steps na kung saan malalaman kung ang isa bang tao ay mayroong hearing loss or hearing impairment. Learners with difficulty in communicating. So before that, we should identify what is the meaning of communication. So, alam ko na we are all aware what is communication is, kasi since junior high school, it was discussed to us, and since we are in the first year of our college, diniscuss din to. So, communication refers to all aspects which make up any exchange of meaning, including speech, language, voice, fluency, and nonverbal and pragmatic communication behaviors. It is the interactive exchange of informations, ideas, feelings, needs, and desires. So, this communication is simply the encoding and decoding of ideas of the person who are talking to each other, or who are communicating to each other. So, it includes yung language na ginagamit or paggamit ng language, yung boses, yung fluency, yung mga pragmatic communication behavior, yung mga nonverbal communication, and it is the interaction of our ideas, feelings, and it is one of way kung paano natin ma-express yung sarili natin through communication. So, communication has different elements. What are those? So, first is a message. Kung ano yung gusto mong sabihin, kung ano yung gustong iparating sa usapan na yun or sa communication. The second one is a sender or the one who expresses the message. So, ito namang sender, this is the encoder of the message or the idea na kung saan siya yung nag-express ng message or nagko-compose. And the third one is a receiver or the decoder of or in the communication. So, or the one who responds to the message. Siya naman yung magre-respond or sasagot doon sa sender. The next is language. Language is a formalized code used by a group of people in order to communicate with one another. So, this language is what we are using. So, here in the Philippines, we have different language. There are different places, different provinces, and in a certain province or in a certain place, there are different varieties, there are different types of language. It is one of the things or ginagamit natin in order to communicate with other people and also to express our ideas and feelings. So, it has 5 dimensions. First is the phonology or the linguistic rules governing a language sound system. The second one is the morphology or the language basic units of meaning and how these units are combined into words, kung paano pinagsasama yung mga words sa isa't isa. The syntax or the system of rules that govern the meaningful arrangement of words, kung paano naaayos or nako-compose yung isang words. The fourth one is the semantics or the meaning of words and combination of words. And the last one is the pragmatics or the social use of language. Speech refers to the oral production of language according to the Ferguson and Armstrong in 2009 and Hayward in 2017. Next in the slide is the communication disorder. So what is this communication disorder? It refers to impairment in the ability to receive, send, process, and comprehend concepts or verbal, non-verbal, and graphic symbol systems. So this communication disorder is a disorder that affects an individual's ability to comprehend, detect, or apply language and speech to engage with other people or effectively communicate with other people, na kung saan ay kahit anong gawin niyang pakikipag-communicate, meron pa ding aspect na mahihirapan siya na i-express yung sarili niya. The second one is the speech or language impairment. It refers to communication disorder, including stuttering, impaired articulation, language impairment, or voice impairment that negatively affects one's educational performance. So, here in the speech or language impairment, isa lang siya sa mga communication disorder na pwedeng ma-adapt ng isang tao. Including dito yung stuttering or yung hindi pagsabi ng words or yung parang nag-i-scattered siya na kung saan parang hihiwa-hiwalay na or hindi na nagko-connect kung ano yung gusto niyang sabihin. And then yung language impairment, yung hindi niya nasasabi sa language na yon, na kung ano-ano na lang yung nagagamit yung language, kung ano-ano yung nasasabi niya. And the voice impairment na nagre-result sa educational performance ng isang tao or ng isang learner. Next is the speech impairment. It pertains to deviations so far from the speech of other people that it calls attention to itself, interferes with communication, or provokes distress in the speakers or listener. This includes articulation disorder, errors in speech sound production, fluency disorders, difficulties with flow or rhythm of speech, and voice disorders, problem with the quality or use of one's voice. So, dito naman po sa speech impairment, these are the learners who has difficulty when it comes to tone ng boses. Meron bagang mga malakagupo, meron din namang sobrang lakatiling or high pitch, and then pwede na din dito pumasok yung yung pagkakaroon ng fluency or hindi ganun pagka-fluent sa pagsasalita or sa pagsabi ng mga words ng kung ano yung gusto niyang sabihin. And then the next one is the language disorder. It refers to impaired comprehension and or use of spoken, written, and or the symbol system. This could involve the form of language, the content of language, and or the function of language in communication, according to Ferguson and Armstrong in 2009 and Howard in 2017, which is the speech and language disorder. So, dito naman po sa language disorder, ito yung mga learners na mayroong impaired sa comprehension, it can be unwritten sa pagsasalita or sa paggamit ng mga symbols or ng kung ano-ano pa man na correlated sa language na ginagamit ng isang tao. So, the next one is the receptive language disorder, is the lack of ability to make sense of or identify sounds and words. It is also called auditory processing disorder. So here, it is a type of communication disorder that a learner or a person don't often understand what others say. So they have struggle with the meaning of language and may respond in ways that don't make sense, but their challenges aren't related to hearing loss or intelligence. Hindi lang talaga sila nakakaintindi ng maayos. And then the next one is the expressive language disorder, is the difficulty in expressing language. An example of this is aphasia, in which one has difficulty in forming and relying phrases and thoughts, even though hearing and auditory processing are intact. So, in this expressive language disorder, this is a lifelong condition that impacts the ability to use language of a certain person. So, a learner with this kind of disorder is he or she can understand what other people are saying, but the thing is they are having a hard time in expressing their own ideas when they speak. So, nahihirapan silang i-express yung oneself nila sa way ng pagsasalita nila or in the form of speaking. Or this is so-called the speech disorder. And the next one is the fluency disorder. It refers to difficulty forming sounds, words, and phrases because of neurological reasons. This includes cluttering or stuttering. So, dito na nag-ano yung scattered, nag-scattered na yung mga words, 'di ba? This disorder, it means that you have trouble speaking in a fluid or flowing way. So, you are not talking, or the learner or person that this fluency disorder is, he or she cannot smoothly or fluid say whatever he wants to say. You may say the whole word or parts of the word more than once, or pause awkwardly between words. This is known as stuttering. You may speak fast and jam words together, or say so dito yung may mga fillers na gumagamit na kasi they are not fluent on what they are trying or tending to say to other people. Speech sound disorder pertains to difficulty in making a specific sound even though there is no physical reason for it. So this speech sound disorder means a child or a learner has a trouble saying certain sounds and words past the expected age. So hindi niya na-meet yung expectation na sa ganitong edad is dapat nakakapagsalita na siya, or na gagamit niya na yung sound na ganito. The next one is the oral muscular disorders, are physical disorder wherein the muscles controlling speech are impaired, injured, or develop mentally abnormal. So, this oral motor disorder is characterized by difficulty in controlling the lips, tongue, and jaw during feeding and or speech tasks. So, wala silang control sa kung ano yung galaw ng lips nila, ng dila nila, ng jaw nila sa oral motor disorder na ito. The next one is the dysarthria. Refers to the lack of ability to execute movements involved in speech, which is a motor planning disorder. So, this dysarthria is one of the kind in the oral muscular disorder. So, this is a motor speech disorder in which the muscles that are used to produce speech are damaged, paralyzed, or weakened. The person or the learner with dysarthria cannot control their tongue or voice box and may slur words. Next is the aprasia, is the inability to coordinate a speech movement, also a motor planning disorder. So, this is one kind of oral muscular disorder din po, which is a neurological disorder characterized by the inability to perform learned the familiar movements on command, even though the command is understood and there is a willingness to perform the movement. Both the desire and the capacity to move are present, but the person simply cannot execute the act, or hindi niya lang talaga magalaw or magawa. And then the third one is the mutism, is the inability to produce a speech wherein muscles are unable to move. So, this mutism is muteness, from the Latin mutus, or silent. It is defined as an absence of speech while conserving or maintaining the ability to hear the speech of other people. So, the next one is the delayed language. It pertains the language of a child who is slow to develop language skills in the context of typical development of motor and other cognitive skills. So, it is a type of communication disorder that a child or a children may have a language delay kapag hindi nila namimit yung language developmental milestone sa ganong edad. Their language abilities may be developing at a slower rate than other most children or other learners. So, hindi parehas sa mga normal yung yung developmental language milestone ng learner na yon na mayroong delayed language.
Good day everyone, I'm Michelle Delatado and I will continue the report of Miss Ivy Volante about communication disorder. So, let's proceed. So, what is a phonological disorder? So, a phonological disorder is the difficulty of phonological rulers that govern the patterns of speech production. So, a phonological disorder is a type of speech disorder or a sound disorder where children find it difficult to sound out words correctly and they are struggle to recognize and process a language pattern. Ang mga batang may phonological disorder ay nangangailangan ng karagdagang suporta lalo na sa kanilang pamilya dahil ito ay naglalay ng mahabang proseso upang sila ay gumaling or kailangan nilang magpakonsulta sa isang speech therapy upang mapabuti ang kanilang proseso. So, for example, a child with phonological disorder may struggle to make the G, K, or D, R sound. Instead, they might use a different sound. For example, they might say wed instead of red. They may also tend to drop a consonant in a word. So, for example, they might say og instead of dog. So, next, the developmental articulation disorder. So, it pertains to the difficulty with particular sound that may relate to the structural differences such as cleft palate or learned movement as a lisp. So, a developmental articulation disorder involves the mispronunciation of speech sound. So, what an articulation is refers to making sound or ang pagbuo ng mga tunog sa isang salita. So, if a child has an articulation disorder, they have problems in making sounds and forming a particular speech sound. They may not be able to produce a particular sound. For example, they can make the R sound and they say wabbit instead of rabbit. Take note that a phonological disorder and articulation disorder are both or they are the same speech disorder. So, ang pinagkaiba lang nila is yung articulation disorder has a problems in forming speech o pagbuo ng salita. While yung sa phonological disorder naman can produce sounds correctly but they may use them in a wrong place. The following diagrams shows the umbrella of communication disorder. So in this figure, it talks about communication disorder. So what is a communication disorder? So it is an impairment in the ability to receive, send, and comprehend the concept, nonverbal or verbal, and graphic symbol system. So it means that a person has difficulty with speech, communication, language, or yung combination ng speech, communication, and the language. These are the language and physical disorders. So let's talk first about language disorder. A language disorder may cause a person to have a reduced vocabulary and limited sentence structure. They often struggle to form complete, meaningful sentences and have trouble in grasping the rules of grammar or the both written and speaking form. So, ang mga taong may language disorder ay karaniwang nahihirapan sa pag-unawa at o paggamit ng mga tamang salita sa isang context. Maaari rin silang nahihirapan sa pagpapaunawa sa isang tao ng kanilang nais na sabihin. The two subtypes of language disorder are the expressive speech disorder and the receptive auditory processing. An expressive speech disorder is a child who has trouble in speaking or expressing his or her thoughts and feelings. So, yung isang batang may expressive speech disorder ay nauunawaan niya yung mga sinasabi ng iba, pero siya mismo hindi niya maibahagi or hindi niya ma-express yung feelings and thoughts niya sa ibang tao. This kind of disorder can affect both written and spoken language of a children who use also sign language can still have trouble in expressing themselves. So, a child who has expressive speech disorder can have trouble in using words correctly, expressing thoughts and feelings, telling stories, using gestures, asking questions, and naming an objects. Next is aphasia. So, it is a communication disorder that makes an individual to use words or nahihirapan silang gumamit ng mga salita. It can affect their speech, written, and their ability to understand a language. So, aphasia results from damage or injury to language parts of the brain, and it is common to adults who particularly had a stroke. So, people who have aphasia may have a hard time speaking and finding a right words to complete their thoughts. So, nahihirapan sila sa pag-iintindi sa kung ano ang pinag-uusapan ng ibang tao or kung ano ang sasabihin nila sa ibang tao. Next, speech sound phonological disorder. It is a phonological disorder or it is a speech sound disorder that is used to describe children who do not follow the typical pattern of speech development. So, a children with phonological disorder may produce sound errors when producing words that are seen in the speech development. So, they can produce sound correctly, but they may use them in a wrong place. Like what I have said earlier, a phonological disorder, they can produce sound correctly, but they may use them in a wrong place. For example, they might say wed instead of red. So next is a lisp. So a lisp is a term often used to describe difficult in making a clear, easy to understand an S and Z sound. Whereas a lisp are caused by the wrong tongue placement in the mouth in which the term obstruct or the airflow from the inside of the mouth, causing distortion of words and syllables. Next is the fluency. Fluency, having fluency disorders means you have trouble in speaking in a fluid or flowing way. Characteristic of learners with difficulty in communicating. So the following describe the characteristic of learners with difficulty in communicating according to Howard in 2017 and Lamp on 2011. So number 1, speech sound disorder. This includes the following. So when we say speech sound disorder, this means that they have trouble in saying certain sound or words. So number 1 is distortion. When speech sounds like intended phoneme or other than another speech sound, but is confusedly wrong. So distortion, it also occurs when the sounds is not left out or subdubbed, but sounds right. Next is substitution. Substitution, when one sound is used as a substitute for another. So substitution, for example, they say wed instead of red, and thumb na T-U-M-B instead of thumb na T-H-U-M-B. So, may pinalitan or binago yung salita. Next is omission. When certain sounds are omitted So, an omissions also occurs when sounds is left out and that is too hard. For example, they might say ed instead of red. Next is addition. Additions when extra sounds are added. Let's take for instance, they might say galwo instead of glue. So, may dinagdag sa isang salita. Next is the articulation disorder. When one is not able to produce a given sound physically because that sound is not one's repertoire. So, articulation disorder, like what I have said earlier, a child has an articulation disorder ay nahihirapan silang sa pagbuo ng mga tunog ng salita ng maayos. Let's take for instance, they might say wabbit instead of rabbit. Next is the phonological disorder. When one has the ability to produce a given sound but does so inconsistently, a phonological disorder can produce sounds correctly but they may use them in a wrong place. Next is stuttering. When there is a rapid fire repetition or repetitions of consonants or vowel sounds, especially at the beginning of the words, prolongations, hesitation, and interjections, and complete verbal blocks. So, stuttering, you may speak fast or you may jam words together. Next is cluttering. When there is excessive speech rate repetition, extra sounds, mispronounced sounds, and poor or absent use of pauses. So, like what I have said earlier, we might say the words or the and sound. Voice disorders. It characterized by having abnormal production or absence or voice quality, pitch, loudness, resonance, or duration that is inappropriately for one's age or sex. It could involve phonation disorder, which causes the voice to sound breathy, hoarse, husky, or trained, or resonance disorder, in which too many sounds come out through the air passage of our nose or not enough resonance on our nasal passage. So, voice disorder, you may have a problem in your pitch, the tone, and the volume of the qualities of your voice. Another characteristics of learners with difficulty in communicating is the language disorders. When there are problems with one or more or the 5 dimensions of language like phonology, morphology, syntax, semantics, or the pragmatics. It could be receptive, which involves in understanding of a language, or unexpressive, which involves the production of language. So I already explained it on the diagrams of a communication disorder. But so a language disorder are people with language disorder often have difficulty in understanding and using correct words in context. So maaari silang nahihirapan sila sa pag-unawa o nais nilang iparating o ibahaging ideya sa ibang tao. Nahihirapan silang makabuo ng sentence. Next is psychological and behavioral characteristics. Limitation in communication skills could have an effect on other developmental domains, including social, cognitive, and academic development. In some cases, delinquent behavior can occur. They may also have difficulty in acquiring metalinguistic abilities. So, a psychological and behavioral characteristic are limited communication skills could affect their domains or their development domains. Types of communication disorder. Communication disorder include the language disorder, speech sound disorder, social or pragmatic communication disorder, and childhood onset fluency disorder or stuttering based on American Psychiatric Association in 2013. So, number 1, language disorder. It refers to the persistent difficulties in the acquisition and the use of language across the various modalities including spoken, written, and sign language. This could include reduced vocabulary, limited sentence structure, or impairments in discourse. Those with a language disorder have language abilities that are substantially and quantifiably lower than those expected at their age. So, this limits them to communicate effectively, participate in social situations, and academically or perform well in one's job. So, language disorder. People with language disorder often have difficulty in understanding and using correct words and context. So, language disorder, nahihirapan silang makipag-communicate sa ibang tao. Number 2 is the speech sound disorder. This involves having persistent difficulty with the speech sound production that interferes with the understandability of a speech or prevents verbal communication or messages. So, this results to the limitation in communicating effectively, participating in social situations, achieving academically, or performing well in one's work. So, like what I have said earlier, speech sound disorders have problems in speech, or they may have trouble in speaking clearly and making the sound they need to talk. They might struggle to control their voices or produce a specific sound. Nahihirapan silang makipag-communicate and verbal communication. Hindi malinaw ang kanilang pagsasalita. Next, childhood onset fluency disorder or stuttering. This involves disturbances in the normal fluency and time patterning of speech that are inappropriate from what is expected of one's age and language skills, and they endure over time. The occurrence of the following could indicate stuttering, such as sound and syllable repetition, sound prolongation or the consonants and vowels broken words, audible or silent blocking, circumlocutions, words produced with excess physical tensions, and monosyllabical words repetitions. This disturbance cause an individual anxiety and limits one to communicate effectively, to participate in social situations, and affect one's academic or work performance. Childhood onset fluency disorder or stuttering. This is also involves a frequent and significant problems with normal or fluency of speech. Siguro naman lahat tayo na stutter. So, those people who stutter know what they want to say, but they have difficulty in saying it. For example, they may repeat prolonged words or syllables, consonants, or vowel sounds, or they may pause during speech because they've reached a problematic words or sounds. Another types of communication disorder is the social or the pragmatic communication disorder. This refers to the difficulties in the social use of verbal and non-verbal communication. So, a social or pragmatic communication disorder refers to the social use of language, of how an individuals interact with others, kung paano natin gagamitin ang salita or kung ano ang sasabihin natin. Or the way we use our body language. So, number 1, these difficulties are manifested in the following. Number 1, deficit in the use of communication for social purposes. So, may kakulangan sa pakikipag-communicate or limited lang yung kakayahan nating makipag-socialize. Number 2, the lack of ability to change communication to match context or the needs of the listeners. So, dito naman, may kakulangan sa kakayahan ng isang tao na baguhin ang pakikipagkomunikasyon niya sa ibang tao para maging tugma ang kanilang conversations. Number 3, difficulties following rules for conversation and storytellings. And number 4, the difficulties in understanding what is not explicit that is explicitly stated. So this cause limitation in the individual communicating effectively, participating in social situations, and having social relationships, achieving academically, or performing in one's job. The last types of communication disorder is the unspecified communication disorder. So, this pertains to having symptoms that are characteristics of communication disorder that cause significant distress to an individual or an impairment in social, occupational, or other areas of functioning but do not meet the full criteria of the above-mentioned disorder. So, dito, sa unspecified communication disorders is when the clinician or the choose not to specify or not to specify the reasons that the criteria are not met of communication disorder. There is an insufficient data to render a more specific diagnosis. So, hindi nila binabanggit yung specific reasons why they have a communication disorder. Causes of communication disorder. The following are the possible causes of communication disorder according to Howard on 2017. Number 1, aphasia, the loss of the ability to process and use speech. This could be due to cardiovascular events among adults or head injury among children. So aphasia makes it hard to use words. So people who have this disorder may have hard time in speaking and finding right words to complete their thoughts due to cardiovascular events, particularly those who had stroke. Number 2, genetics. The phonological disorder and stuttering could be linked to genetic causes. So, another reasons of communication disorder is their genetics or kumbaga, namana nila yung genes from their parents. Next is the environmental factors. For instance, when children are punished for talking, gesturing, or trying to communicate, or the lack of stimulation and motivation to participate in communication or interact with others at home. Identifying learners with difficulty in communicating. The following areas can be looked into in order to identify learners with difficulty in communicating. According to Howard on 2017, number 1, the case history and the physical examination. The child's case history is documented. The biographical information, as well as the milestones of child's development, is asked from parents and the specialist. Thus, a special or physical examination of the child's mouth in order to find whether there are any irregularities in the tongue, lips, teeth, palate, or the other structures that could affect production. So, dito sa case history and physical examination, inaalam ng specialist or yung speech therapist na yung background ng isang bata para ma-identify na mayroon siyang difficulty in communicating. Number 2 is the articulation. The specialist assesses speech errors and record sounds that are produced incorrectly, types of mispronunciation, and numbers of errors. So, they have problems in forming speech sounds properly or movements, the lips, tongue, teeth, and the palate. So, dito, yung specialist, ina-assess nila yung isang bata na pinaghihinalang may communication disorder. And through testing their movements of their lips, tongue, teeth, they can identify that that child have a difficulty in communication.
Hey everyone, I am Razel Nagales. I will discuss the identifying learners with difficulty in communicating. The following areas can be looked into the order to identify learners with difficulty communicating. Howard 2017. The first is case history and physical examination. What is the meaning of that? The child's case history is documented. Biographical information as well as the milestone of child's development is asked from parents, and the specialist do a physical examination of the child's mouth in order to find whether there are any irregularities in the tongue, lips, teeth, palate, and other structures that could affect speech communication. Sa case history, inaalam ang biographical information ng isang bata as well as the milestone of the child's development. And then the specialist examine the child's mouth to identify if there is an irregularities in communicating speech. The next one is articulation. What is articulation? The specialist assesses speech errors and records sounds that are produced incorrectly, types of mispronunciations, and numbers of errors. Sa articulation naman, ang specialist nag-a-assess ng speech errors and nire-record niya ang sound na naproproduce na isang bata na incorrectly. Hearing. The child hearing is evaluated in order to identify whether a child's hearing problem that is causing the communicating disorder. Isa ang hearing sa pag-identify ng communicating disorder ng isang bata. Ito ang dahilan kung bakit hindi masyado nakakapag-communicate ang isang bata dahil sa kanyang pangrinig. Next is phonological awareness and processing. When children is lack of phonological awareness and processing skills, they could have problem with receptive and expressive spoken language as well as difficulties in learning to read. Kung ang isang bata ay may kakulangan sa phonological awareness and processing skill, mas mahihirapan ang isang bata sa pagsasalita, and ito ang nagiging rason para magkaroon siya ng difficulty in communicating. The next is overall language development and vocabulary. Test that measures a child's vocabulary. Example is Fee Body Picture Vocabulary. Test 4 Done and Done 2006 as an indicator of language competencies that can be administered. Assessment of language function. This includes the identifications of learners' strengths and weaknesses in various language functions, then comparing them to language and communicating skill of typical developing children. Dito naman, ina-assess ang weaknesses and strengths ng isang bata sa pagko-communicate. Next one is language samples. Samples of child's expansive speech and language are taken and examined. Dito naman, ang isang bata ay ini-examine sa pagsasalita. Observation in natural settings. Children's use of language are observed as they engage in everyday activities. Dito man, ino-observe ang isang bata sa kanilang day-to-day activities. The next topic is about the learners with autism spectrum disorder. What is autism? Autism is a developmental disability that affects one's verbal and non-verbal communication and social interaction. This is usually evident before a child turns 3 and it negatively affects a children's education performance. Ang autism is a non-verbal and verbal communication, and ito ay nalalaman pag ang bata is 3 years old na, and then it is negatively affect a child's education performance. And may mga rason kung bakit ang isang bata ay nahihirapan sa kanilang pag-aaral, which is isa na nga ang communicating disorder. The next one is autism spectrum disorder or ASD. What is autism spectrum disorder or ASD? It refers to persistence defects in social communication and social interaction across various contexts. This is manifested through problems with social emotions, reciprocity, lack of use and understanding of nonverbal communication, communicative behaviors, and difficulties in developing and maintaining relationships. Those with ASD also have restricted, repetitive patterns of behaviors, interests, or activities indicated by at least two of the following. One is stereotype or repetitive behavior, insistence on sameness, highly restricted, fixated interest, and hyper or hyporeactivity to sensory input, or usually interest in sensory aspect of environment. Table 6.8 Characteristic of learners with autism disorder. The following are the characteristics of learners with autism spectrum disorder. Number 1. Social communication impairments. Characteristic: demonstrating appropriate play skills. Some may reject or ignore the social approaches of others. Responding to and initiating joint attention for social purposes. Using, interpreting body language, staying on topic, turn-taking, asking related or appropriate questions during conversation, and taking others' perspective. Dito sa social communication impairments, nagde-demonstrate siya ng appropriate play skills, and some is may reject or ignore the social approaches of others. Nire-reject niya ang approach ng ibang tao. Next is speech language impairments. The characteristics is for those who are non-verbal. Number 1 is delayed in or lack of spoken speech language. Next is lack of effective way to communicate. Sa speech and language impairment, para sa non-verbal is meron siyang delay on speech language, and then meron siyang lack of way to communicate. Nahihirapan siya makipag-communicate sa ibang tao. For speech and language impairment also, and then for those who are verbal, delayed or immediate echolalia, stereotype or repetitive use of non-echolalic language routines, use of idiosyncratic speech. Next is immature grammatic structure, and next is abnormal use of pitch, intonation, rhythm, or stress. For both verbal and non-verbal, delayed vocabulary development, difficulty following directions, difficulty understanding abstract concept, and difficulty in interpreting social language. For both verbal and non-verbal, meron sila parehas delayed in development. Delayed sila sa pag-develop ng kanilang vocabulary. And then, difficulty in following direction. Meron silang kahirapan sa pag-follow ng mga directions. And then, difficulty understanding on abstract concept. Mas nahihirapan sila sa pag-intindi sa mga abstract concept. And then, interpreting social language. Nahihirapan sila sa iba't ibang language. Next is restricted repetitive and stereotype patterns of behavior, interests, and activities. Characteristic: stereotype or repetitive motor movements such as hand flapping or finger licking. Excessive adherence to routines and sameness. Ritualized patterns of behaviors. Highly restricted, fixated interests that are abnormal in intensity or focus. The next is sensory differences. The characteristic of sensory differences is visual input sensitive, stating at spinning objects being bothered by fluorescent lights. Next is auditory input sensitivities, covering ears during loud noises, preferring loud music, or not at all in the car. Next is tactile input sensitivities, disliking getting hands or feet messy, preferring certain surfaces, textures, or fabrics. In sensory differences, sa visual input sensitives is sensitive sila sa mga fluorescent light and spinning objects. Next is auditory input sensitivities. Ang mga merong auditory input sensitivities is mga sensitive sila sa mga loud noises. And then tactile input sensitive is ayaw nilang yung paa or kamay nila is messy. Next is characteristic of sensory differences is about taste, smell sensitivities. Not eating foods, licking or tasting non-food items. Next is proprioception input sensitivities. Difficulties interpreting sensation for muscle joints, ligaments, and tendons. Vestibular input sensitivities. Over or under sensitivities to balance and movement sensations. Next is executive foundation impairments. The characteristic is difficulty with executive functioning tasks such as sequences the other in which to dress oneself, completing a homework assignments. Next is rigid inflexibility thinking. Executive functioning difficulties at basic level such as sustaining prolonged attention to an activity or dividing attention between two activities at once. Next is common learning characteristics. First, demonstrate exceptional rote memory skills. Being better able to process information when presented visually. Difficulty with unconstructed time or extensive waiting. Difficulty generalizing learned skills from one settings to another. Difficulty with organization of materials and activities. Highly achieving in some specific areas and doing poorly in rest. Causes of autism disorder. The following are the risk factors of autism spectrum disorder or ASD according to American Psychiatric Association 2013. The first cause of autism disorder is environmental. Risk factors include the paternal age, low birth weight, or fetal exposure to substances such as valproate. Sa environmental, merong risk factor na nag-cause ng paternal age or low birth weight or ang fetus is na-expose sa substance such as valproate. The next cause of autism disorder is genetic and psychological. ASD is heritable to some extent and having a family member with ASD increasing the risk of developing it. Ang ASD is genetic. Ito ay inheritance kung ang isang member ng family is merong ASD and maaari itong mamana ng isang bata. Next, however, there are no clear medical or psychological markers of autism. Most of the cases are inadaptive. Identifying learners with autism spectrum disorder. The following are some of the instruments used in assessment of ASD. Some are the checklists completed by parents or caregiver, while others are interviews administered by trained examiners. The first is the Social Communication Questionnaire, or SCQ. A 400-item scale accomplished by a parent or primary caregiver. The next is Autism Spectrum Screening Questionnaire, a 27-item scale accomplished by parents and teachers. It is used for screening high-functioning ASD in children. The next is about the Autism Diagnostic Interview, or ADIR, and Autism Diagnostic Observation Schedule, or ADOS. ADIR is a semi-structured interview of the primary caregiver of the child or adult suspected of having autism administered by trained examiner. ADOS is a supplement to ADIR wherein the child is prescribed with a set of interaction designed to evoke behavior that indicate autism. Ang ADIR daw is a semi-structured interview na ginagawa ng primary caregiver or ng isang bata na suspected sa autism, and it is administered by a trained examiner. Ginagawa lang ito ng mga trained examiner. Ang ADOS naman daw is a supplement to ADIR wherein the child is prescribed a set of interaction designed to evoke behavior that indicates autism. The next is Speech and Language Development Milestone. The following checklist is provided by the National Institute of Deafness and Other Communicating Disorder, 2014, in order to help identify whether a child is developing typically or if there is a sign of speech and language disorder. Ginagawa ang speech and language development milestone para malaman kung ang isang bata ay may sign ng speech and language disorder.
Table 6.9, Speech and Language Development Milestone. So, ano nga ba ito? This slide and to the upcoming slides, it shows the checklist. The table shows the different development processes of a children learning to use language and speech. So, we are no longer to explain it one by one. We are going to flash the table na lang po because it is very self-explanatory naman and it is just a checklist kung yes or no na ba ang nagagawa ng isang bata. For instances dito, from birth to 3 months, ang bata ba ay nakaka-react na sa mga malalakas na sounds. So, i-check lang kung yes or no. Up to 4 to 6 months, meron ding mga iba't ibang bagay na kailangan ding i-checklist. 7 months to 1 year. And then, sa 1 to 2 years, and 2 to 3 years, and 3 to 4 years, and 4 to 5 years ang paglaki ng bata. So, it is self-explanatory. You just have to take a look sa susunod na mga slides. So, that is all for the chapter 6, the types, characteristics, and identification of learners with difficulty seeing, hearing, and communicating. So, in behalf of the group, we would like to extend our gratitude for having the patience and time and watching our prepared video presentation, even though it took more than an hour because it is one of those topic na sobrang haba talaga. And thank you again, and we hope you enjoy and learn something from us.